Hi, I'm Dr. Joe Singh with Meridian Health Center. Come with me as we walk through a new patient process here in our office. As you walk into our office, you will run into our front desk where our friendly staff will be gathering all the information we need from you. That will be your intake form, any x-rays, MRIs, labs that pertain to your health condition. As we gather your information and everything looks good, then we're going to go back to our examination and determine exactly what's going on with your low back. That's where our friendly staff will either grab myself or an assistant to bring you back to the examination room. So come on with me, let's head out back to the examination room. As we go back to the examination room, we typically give a tour of the office where we show people where our adjusting rooms are, our jumper seats where people are waiting to get adjusted, our warm-up exercises, and our rehab room. As we walk here into our exam room, this is where we're going to get our detailed information of what's going on with you. We're going to sit down with you and go over your history and your goals to determine exactly what is going on with you, what are your goals with your health, and how can we help you achieve those. Once we get your history, then we're going to do a thorough consultation to find out exactly what's causing your low back pain, when it started, how it's affecting your daily activities, and how we can help you with that. Once we determine what's going on there, then we'll start our orthopedic and our neurological tests. We start off, first of all, with the postural analysis to see how your body is responding to gravity. Then we'll do a surface EMG scan, which is a scan that looks similar to this, where we will scan your spine to see if there's any nerve irritation causing an imbalance in musculature in your spine. From there, we'll do some orthopedic tests to determine exactly where your low back pain is coming from. Is it coming from a nerve? Is it coming from a disc? Is it coming from a muscle? Is it coming from a joint? Once we determine where that is, we may do some neurological examinations as well to determine where that sensory deficit may be. Once we gather all of that information, then we're going to go back to the x-ray machine to see exactly where that is located to see how we can address it. So we'll come back into our x-ray room, and this is where we're going to take at least four digital pictures of you to determine exactly what is going on. We take x-rays because we want to know exactly what's going on. We do not want to guess. So our standard x-rays that we will take are 4 views. We would normally take a side view of your neck, a side view of your low back, a front view of you, and a front view of your lower back, so we can determine exactly what's going on. X-rays tell us where the subluxation is at, how long it's been there, and can we fix it. Once we are done with that, we will send you back up front and we will get you scheduled for what we call your second visit, or your day 2 is what we call it. And in that day 2 is when we will bring you back within 12 hours so that we can go over the results of your examination and your x-rays. So we'll bring you back to our exam room here, and we're going to teach you a couple things. What a normal x-ray looks like. So when we're back in here, we'll show you what a normal x-ray looks like, what it should be in position, and then we'll come over to yours and show you exactly what yours looks like so you can have a comparison. Once we establish exactly where your subluxations are at and where your low back pain is coming from, then we're going to start our adjustment process. We're going to do what we call a pre-warm-up, give you an adjustment, and then get you scheduled for your third visit. So we're going to come on out here and we're going to show you exactly the pre-warm-up exercises. Here's where we have our pre-warm-up exercises. This is what we call our wobble chair. These are specifically for low back pain and lower back issues. So as you can see here, Kristen is doing some simple lateral movement on this wobble chair to help hydrate the discs of the spine to get some mobility starting into that spine. These exercises are very important for the discs to start hydrating them to help reduce the pain and inflammation within the spine. Once we establish these exercises, we go on back to our adjusting room where we perform our adjustments so that we can now start getting that body to heal. So when we enter into our adjusting room, we will lay you down here on the table where I will have your file and your x-rays up on the computer so we can see exactly where those misalignments are that are causing your low back pain, and we will perform a specific chiropractic adjustments for those areas to start getting your body to start to heal. Once we establish that, we will walk up to the front, we will get you checked out, and we'll get you scheduled for your third visit in our office, which we call our day 3, which is your doctor's report or your report of findings. On that day is where we will go over everything that we compiled together, how you responded from your adjustment, and then we will have a created treatment plan where we will go over what it's going to take to get you well and stay well and to eliminate any pain that's going on in your low back. So hopefully that helps to see how our process is. If you're looking for anybody that needs any kind of care or for yourself, we first of all just thank you for looking at our website and our webpage, and we'll look forward to seeing how we can help you. Thank you.
I think that whole thing